9th of February 2024, and we have come to Azad Maidan as street providence. Because आमचो एक demand हा जे so becoming a big problem in the home. See, we are looking after psychiatric patients, mostly who are goans, and some of them are chronic patients. Chronic means that there will be somebody here. There is a patient here whose registration number is 25,000. Means that's 35 years old patient. There is another 2 patients here who are 35,000 registration, and now the registration number is 1,30,000 plus approximately. So these are patients who are goans, who don't have families, who require constant care. Now our capacity as of today is 240 beds, of which we are close to almost 172, 173. Now all these patients are taking 6 to 10 tablets, most of them, because that is called chronic. Now we take them for assessment, but most of the time these chronic patients cannot be stabilized because of various reasons. So we have some issues in the house, and those issues now are getting little serious. Hitting, pulling the hair, tomorrow if something goes wrong, unfortunately something goes wrong, we will be blamed. If we drop them back to the hospital, they will be kept in the hospital for few months, few years, till they are moved to provisory. We have been time and again requesting IPHB, see, please don't waste our time when we are bringing these chronic patients back for admission. They take 3 hours, 4 hours, 5 hours, asking the same questions when the file of that individual patient is so fat. Now, recently what happened, just 2 days back, I took one chronic patient. She is only 28 years old. From the age of 16, she is taking psychiatric medicine. She has no parents, no family, no brother, sister, go on living. When they were doing the evaluation only, she got aggressive and she almost hit the ward boy. Now, if in the hospital, before admitting, they are getting violent, and you are interviewing these people for 2 hours, 3 hours, 4 hours, you are going to admit, that we also know. We are saying what? Do the admission as soon as possible. Why? The caregiver who stays in the home does not come with the patient to the hospital to admit. We have a separate team. Now, if you ask the same question again and again, we are going to give the same answer, which the caregiver who came with the patient to the hospital may not be giving the correct answer. But if you admit the patient in the night, you observe what is the reaction, and morning you ask the same question to us, we'll give the answer. Na? You are asking the same question in the night, and every time there is a new doctor who is interviewing the same patient. That's why our demand is what? You send a psychiatrist from the IPHB to our shelter homes and treat us on par with what you are treating Providoria. We have today more than 135 chronic psychiatric patients with us. Providoria does not have that many patients. But you are giving the psychiatrist from the IPHB to Providoria to do their evaluation. What about us? Why should we be left out? Or you transfer all these chronic patients back to the IPHB and you put them in Providoria. This is our demand, and this is the first protest we are having peacefully. This is the first protest we are come to voice our views with few inmates. We have brought only few ladies, and all these ladies you can see here now, only one is a non-goer, because she is from the elderly lady, she is a non, all are goers. So everybody is aware at the IPHB that we should get a psychiatrist. MS also is aware, Dean also is aware. But they are waiting for the higher ups to move. Now, higher ups are also aware. Now, who is going to knock on that door and open the eyes of the higher up? So that's why we are forced to come here, so that the message goes to whichever higher ups are there. But please consider our case, or don't recommend any patients to us. First of all, IPHB is discharging patients within 7, 10, 15 days. After 3-4 days or 1 week or 2 weeks, again the patient comes inside. See, the IPHB, the government is spending money extra on this particular process of routing the patients again and again and again. Whereas we are in our shelter home, there is not so much of kharcha they are doing. Second thing, either they will reach the street, they will get into unwanted confusion, and they will remain there only. Again they will come inside. So we feel that our demand We have only one demand today, is that you please provide us a psychiatrist, not one, since we will be touching very soon 240 inmates. How do we bring 240 inmates to a hospital every month for an assessment? There are only 24 days, sometimes there are 24 working days. 4 Sundays are there, some public holidays. If we are going to bring 10 patients, how many vehicles we require? How many drivers we require? And how is it possible to bring so many of them? So we are not going to let the patient suffer. Neither do I and my team want to get stressed. It's a clear demand that if it's not met and the psychiatrist is not given to us from the IPHB like they get to Providoria, then what you see 10 patients, next time there will be maybe more patients. And we wanted to take this protest to IPHB. But since it's a hospital, since the OPD should not get disturbed, since the IPHB is not having a problem with us. And I would like to thank the IPHB for all the services they have been giving to us in the due course of time. But at the moment, they also are helpless. The doctors also are helpless. They have assured informally that as quickly as possible the admissions will take place, which we appreciate. But without the higher ups, that is the government or whichever department, does not address this topic where we are concerned, we will not stop the protest. Another thing I would like to tell, see, we take support from social welfare, we take support from factories and boilers, we take support from civil supplies, we are also taking support from women and child. Now health and women and child is the same minister. If the women and child is giving us the grants towards taking care of these women, that is one part. Why can't the health department give us the same facilities towards the same cause? The patient or the party is the same. Either it's social welfare for men or women and child for women. Psychiatrist belongs to both. The system is so complicated that nobody wants to jump into it. Neither does anybody want to address our issue. So we are aware through WhatsApp chats, through messages which have come, that IPHB cannot be blamed in this. They are aware that this is our demand. They are also aware that the higher ups have to take up this matter. And it's a request. For us, higher up means Women and Child Secretary Arun Kumar Mishra ji. Sir ji, this is your issue and you need to address this as soon as possible. See, we have limited options to protest. One is here. Next will be at the Secretariat. Third, it can be at the CM's house. Fourth, it may be at the Governor's house. We are not going to go to any minister because there is a bureaucracy. The bureaucracy is paid to do their job. The bureaucracy, if the social welfare secretary, who I met only once, can approve certain schemes and grants by understanding a problem and telling the department, you give him the grant without a valid documentation because they don't have valid identity, why do I need to go again and again to the same bureaucrat and tell him, sir, please approve my file? If the Chief Minister of Goa has instructed the Social Welfare Minister, sir, give them DDSY benefit to our Goans who are not having any identity based on a valid prescription of the IPHB, which has 2 years, 3 years, 4 years, 5 years, and the DDSS, that is the Social Welfare, is listening, then what are we exactly sitting and asking for? Can't the government, can't a particular department understand our problem, understand our frustration, understand the need of the hour? Today it is 240, tomorrow it will be 500 inmates. How are we going to manage? They have limited options. Either they shut us down totally and take all these chronic patients back and look after them and don't recommend, or either they just give us some psychiatrist who can manage our shelter homes, and in this way everybody will be at peace.
Sir, तुम्ही डिपार्टमेंटाक लेटर केला, हेल्थ सेक्रेटरीक लेटर केला?
2 years back, when Rajshekhar was the health secretary, he issued an order. It's an order, not even a note, that each and every primary health center which is nearest to our shelter home has to visit a shelter home and treat these patients every 15 days, which is not being implemented by DHS. Okay, we took this order and went to IPHB doctor, I will not quote his name because that is his. He said, see, I don't have psychiatrist. So I told him, if you don't have psychiatrist, how you are sending to Providoria? He said, that is government. So I said, if that is government, put these people in the government. Why you are recommending them to the shelter homes? If we are not going to be treated as part of the government and government is funding us, then either you stop the funding and take the people back, and we get out of this free service.
So this is IPHB, which is the one recommending this patient to your
Yes,
center.
see what happened now, the hospital is getting crowded, the cases are rising, people are getting older. You can see most of them here are elderly people who don't have any support back home. So what happened? They keep roaming around, keep creating a disturbance in society. Problems जाता, police त्यांका आडान घालता भितर. कोण तशें दोत्ता तेच भायर काडटा, तेच पोत्ते भोंवता. आतां पोत्ते भोंवन नंबर वाडला न्हू, केसी वाडला. तेंचे शेल्टर होम ना, तेंचे कडेन मिडवे होम ना, तेंचे कडेन कांयच सपोर्ट ना. आतां मॅजिस्ट्रेट ऑर्डर सुद्दां जे हाडटा आनी घालता तेंकाय भायर काडटा. फक्त आमकां दिता थोडे बेनिफीट जे आमी हॅपी आहा. पूण नंबर फाल्यां नंबर वाडटलो. 300 लोक आसतले, 200 लोक आसतले, 500 लोक. आमी कशें इतले पेशंटाक व्हरोंक मंथली तेंकां आमी सरकाराक सर्वीस दिता, फुडें प्लॅनिंग दाखोवंक बाबा हे आमी कोत्ता. तेंकां तर अक्कल ना तर तेंकां अक्कल दिवचो पडलो न्हू. So we are telling the social, the women and child secretary, and who is also the health secretary, Arun Kumar Mishra ji, sir, please look into the matter. Don't make us bring them and come to the secretary.
सर 2 महिन्या फाटी तुम्ही CM सराक मेळ्ळे तेन्ना तुमी रिक्वायरमेंट सांगिल्ले सराक?
See, 2 महिने पयलीं आमी जे पॉयंट घेवन गेले तो एक ग्रांटाचो इश्यू. सो आमचे म्हणजे खूब पॉयंट्स आहा, आमी सगळे मिक्स करूंक शकना. सो आमचो पॉयंट अजून आहा दुसरे डिपार्टमेंटाचे जे हांकां केअर आनी मेडिकल बेनिफीट मेळोंक जाय. पूण आयज आमी आमचो मेन पॉयंट कितें आहा, IPHP. आमी एकूच पॉयंट घेवन येयला आयज बाबा आमकां तुमी सायकॅट्रिस्ट दिया जे तुमी प्रोविदराक दिता, नाल्यार ह्या पेशंटाक सगळ्या प्रोविदरान घाला.
थँक्यू.
Thank you.
आणि उलोवपाचो आनी कोण उलोवपाचो? डोनाल्ड.
हॅलो
ए दर परत
ओके.
येस सर.
I'm Arturo D'Souza and I'm a volunteer at Street Providence. जाला कितें थोडे दीस फाटी डॉनल्डान म्हाका फोन केलो मातशें यो. हें जालें 10 सुमार. कित्याक एक पेशंट हॅज लॉस्ट मायंड एंड अटॅक्ड द इनमेट्स. तर हांव गेलो थिंगासर. पळोवंक गेल्यार हो ते पेशंट पळय आसा न्हू, जे आमचे क्रॉनीक पेशंट आसा ते 9 गेलेले, 10 जाली, 11 जाली. आमी भोंवता म्हणून 11 जाली तरी ते डॉक्टर ताका घेवन बसला आनी ताका कडेन खबरो करता. तर हो एक डिमांड म्हणटा पळय तो सारको डिमांड. तुमी तर प्रोविदराक कित्याक आमी कितले फाटी गेल्या थिंगा IPHBन आमी प्रोविदराच्यो गाडयोच पळयना. तर रिजन कितें जावंक शकता? एक जावंक शकता की डॉक्टर थिंगासर डॉनल्ड सांगता ते भाशेन डॉक्टर थिंगा वयता आनी तांकां ट्रीट करता आनी थोडे ताका लागून ते IPHBन येयना, रिफर जायना ते. सो आमचो होच एक डिमांड आहा आनी तो डिमांड म्हणटा पळय तो ट्रीट अस ऑन पार विथ प्रोविदरिया. दॅट इज दी ओनली थिंग दॅट वील हेल्प अस आउट. बिकॉज कितें जाता ट्रान्सपोर्ट जाता आमकां जाय वी रिक्वायर नर्सीस टू टेक द पेशंट टू द हॉस्पिटल. सो हो ट्रान्सपोर्ट आहा हो आमचो एडिशनल बर्डन जाता. प्लस आमकां वी हॅव टू पे द नर्सीस. सो हो एडिशनल कॉस्ट आमकां अननेसेसरीली आमच्या तकलेर बसता, स्ट्रीट प्रोविडन्साचेर बसता. सो ताका लागून आमी इतलेंच मागता आनी होच एक डिमांड आसा. तुमी इतले पयशे पळय मोडटा पळय दुसऱ्या जाग्याचेर इतले पयशे मोडटा, तूं आमकां थोडे तरी आमकां कन्सिडर कर. डॉक्टर्स तर आसताच, डॉक्टर सायकॅट्रिस्ट आसताच ना म्हणून तशें म्हाका दिसना. कित्याक GMC इज ऑल्सो हॅविंग सायकॅट्री मेडिकल स्टुडंट्स. So I don't think so that that is a valid reason saying that there is no psychiatrist to give. So what's a demand of that?
थँक्यू.
येस थँक्यू सर.
वो आमचा मॅनेजर वो ॲक्च्युली ऑपरेशन कामात आहे. ही हॅज ऑल द प्रॉब्लेम.
होय, माझे नाव सपनेश सालगावकर.
तर मातसो जोरान उलया.
माझे नाव सपनेश सालगावकर आणि हांव ऑपरेशन मॅनेजर स्ट्रीट प्रोविडन्स. आमकां जे प्रॉब्लम फेस जाता पयलीं सांगता तुका आमकां प्लॅनिंग आमकां डेली 10 to 12 पेशंट एवरीडे आमकां IPHBन जावं दुसऱ्या डिपार्टमेंटान वचचें पडटा. जेन्ना IPHBन आमचे डेली 5-6-7 केसीस आतां चालू आहा तेन्ना आमचे कडेन इनमेट एक 170 आमचे कडेन इनमेट्स आहा सो जर हे केसीस वाडल्यो जाल्यार इनमेट्स वाडले 250 जाले जाल्यार इट वील बी डिफिकल्ट आमकां चड प्रॉब्लम जातले कित्याक वी हॅव ऑलरेडी 5 व्हेहिकल्स 5 गाडयो आमच्यो ज्यो वयर सकयल हॉस्पिटलान धांवता आतां जर पेशंट वाडले जाल्यार आमकां ह्यो गाडयो पसून पावचे ना ड्रायव्हर पावचे ना केअर गिवर पावचे ना कित्याक नाव प्रेजेंटली एका घरान आमी 2 केअर गिवर दवरला एका घरान 15 पेशंट आहा 15 पेशंटले 5 जाण गेले जाल्यार तेज्या कडेन एक आमचो केअर गिवर धाडचो पडटा तो धाडचो पडपाक लागून आमकां आनी एक केअर गिवर एका घरान 3 जाणां दवरची पडटा कित्याक एकटेक तेज्या वांगडा धाडून बाकीचे 2 जाण बाकीचे आहा तांकां पळोवपाक तर हे जे आमकां प्रॉब्लम फेस जाता जेन्ना आमकां व्हरचें पडटा आनी हाडचें पडटा एकाच प्लॅनिंग करून एक दीस पयलीं प्लॅनिंग कर सगळ्यांनी व्हर तांकां दुसरे दीस सगळ्या ड्रायव्हरांक अरेंज कर केन्ना ड्रायव्हर ना तेन्ना परत प्रॉब्लम आमकां गाडयो घेवन धांवचें पडटा आमी स्ट्रेस जाता वचून जर आमी आतां प्लॅनिंग करिना हेजेर जाल्यार फुडें आमकां आनीक त्रास जातले आमी कितें म्हणटा जर प्रोविजोरियाक जर तुमी डॉक्टर धाडूंक शकता सायकॅट्रिस्ट जाल्यार तुमी आमकांय तेच धाडूंक जाय स्ट्रीट करून आमचें हेंच रिक्वेस्ट आहा जे तुमी प्रोविजोरियाक दिता ते आमकांय दिया सो आमचे स्ट्रेस कमी जाले सो वी कॅन लूक आफ्टर मोर पीपल इतकेंच सांगूंक
हो तुमचो फायनल प्रॉब्लम आहा वो आनी कितें प्रॉब्लम आहा
पळय प्रॉब्लम्स खूब आहा बट टुडे आयज आमी फक्त वो नोटिफाय करता कित्याक हे आमकां इशू हो मोस्ट आतां हँडल करचे पडटा कित्याक केसीस वाडल्या आनी केसीस आमकां डेली 2-3 कॉल 4-5 कॉल येत आसता बाबा एडमिशनाक सो आमकां ते एसिस्टमेंट करचें पडटा पेशंटांक पळोवचें पडटा आमी जर घेत रावले जाल्यार पेशंट वाडत रावता एक तर तूं IPH दिसून डिस्चार्ज जावन घेतलो जाल्यार ताका 7 दिसान परत व्हरोंक जाय इवॅल्युएशनाक एवरी 2 मंथ्स तरी व्हरोंकूच जाय जर ताका 2 मंथ्स आमी एवरी 7 डेज व्हरतले जाल्यार 10 जाणांक घेतल्यार 10 जाणांक 7 दीस व्हरचें पडलें जर एका घरांतल्या 10 जाणांक व्हरचें पडलें जाल्यार बाकीचीं घरां कितें करचीं पडटलीं तर प्लॅनिंग मॅच जायना कळ्ळें न्हू आमचे कडेन 4-5 ड्रायव्हर आहा 5 गाडयो आहा आतां जो पर्यंत एडजस्ट जाता तो IPH बी बाकीचे आहा जनरल मेडिसीन GMCन व्हरचें पडटा CT स्कॅन करचें पडटा आनी कितें जाता ते रिफर करून दिता IPH बी बाबा तेजो CT स्कॅन कर ब्लड टेस्ट CT स्कॅन खंय करतले GMCन व्हर परत IPH बीन बरोवन दिता ते परत घेवन GMCन व्हर आमी पेशंटाक घेवन भोंवत रावता आतां सकाळीं भायर सरता 8 आमी दनपारां 1:30 दोनां भायर ही आतां पेशंट हांकां टिफीन घेवन धाडचें पडटा आमकां जाल्यार तांकां उपाशी दवरूंक शकता आमी 1.5 वर 2 वरां जायना न्हू तें ताका लागून म्हणटा जर आमकां जर हे फॅसिलिटी मेळटा जाल्यार आमचें काम इजी जातलें की एव्हॅल्युएशन करपाक इजी जातलें आनी मेडिसिन्स मागीर ते आमकां हाडूंक जाता ते व्हडलें डिफिकल्ट न्हू मेडिसीन हाडपाक इतकें
तुका पेशंट दाखयता हे आमचे गोंयकार नांव सांगिना हे गोंयकार शरावचे हे गोंयकार नावेलीचे फाटले आहा ते आसामचे पूण ताका हे आहा पाकिस्तान
ओके
हे आहा मळकोणे गोंयकार आदले पेशंट ते बिचोली शिकलेले मनीस ते तेजे सायडीक वास्को क्रॉनीक केस गोंयकार तेजे सायडीक आहा ते मिक्स गोंयकार आनी फाटल्यान आहा ते पेडणेचे मदले कोण आहा ते क्रॉनीक प्लस TB आतां हातूंतले न्हू 5 जाण तरी भितरूच उरतले आमी घेना जाल्यार आनी पर्मनंटली उरतले भितर ते 3 वर्सां रावले भितर आनी ते शिकलेले मनीस सो आमी कितें करूं आतां
थँक्यू
ओके थँक्यू सो मच